by one of the very close friend of us, Dr. Manohar KN. So everybody is, I think, knowing him. He is a triple FRCP, you can see. And he is MBBS from the KMC Bangalore, clinical examiner for the MRCP UK. He is organizing secretary, KRSSDI 2017, chairman reception committee, APICON 18, and recipient of excellence in diabetes care, many awards, rising star in diabetology. So I have great pleasure to introduce him and ask him to present this very, very important and relevant topic that is by Dr. Manohar. Is an expert on that, I believe. So Dr. Manohar, can you start?
NK Singh sir, I will just like to highlight that Dr. Manohar is not going to share any presentation, and we are going to, this is a chat session where we are going to talk to him and how he is including the physical activity in his busy professional life so that we all can learn from him. So Dr. Narsingh Verma sir, Dr. NK Singh sir, all of you are free. What we have got is that we have got some photographs, some videos of Dr. Manohar, which we will be playing in the session, and which are showing that how seriously he is engaged in physical activity. He is actually not just speaking on the subject, he is actually doing that. So yeah, this is the idea which was suggested by our governor in the last meeting, Dr. Anuj Maheshwari sir, that better to bring him on the platform because he himself is an ambassador of the physical activity. So we thought that, yes, sir. So please go ahead and you can start with your first question, and we will in between.
So this is also a big thing that he is not sharing anything on the screen, but I think he is a role model. He is not only preaching about the exercise. I have, as you know, that he is also a marathon runner. So he knows the art and science of the exercise. Because science, most of us know, but the most important question today, as far as the professional life is concerned, the art, how to implicate the art in the exercise. As in the ADA, many times we have heard, there are so many benefits of exercise. Everybody knows. You can enumerate hundreds of benefits. It is also has been stressed that exercise not only brings the benefits in future, but if you do it today, you will get the benefit immediately. Today itself. Still, the most important question is, when there are so many benefits, rather Phil Sutherland, of the director of the Novo team type 1, says it is $1 million, billion, whatever you say, the $1 million drug, which you do not do. So Dr. Manohar, first say why people are not motivated to do such a wonderful thing.
Yeah, firstly, I would like to thank ACP and all those kind words. I have learned a lot from CME India, NK Singh sir. Most of my slides on exercises, knowledge, which is very, very important, is come from him and his groups. So thank you for that. As doctors, I always feel we read a lot about pathology than physiology. We read a lot about illness than wellness, isn't it? So wellness possibly that too more to learn what is happening than how to make it happen in physiology and the first years of medicine. So somehow we get like the famous adage that poor doctors treat complications, good doctors prevent even the risk factors, or primordial prevention, if you want to talk about it, or primary prevention. So learning is definitely mutual. So especially thanks to this opportunity for early care physicians, especially because if we don't inculcate early enough, we will not be doing well in the later part of life. So the question was about fitness. If you really look at even Bhagavad Gita says the only lifelong companion we have is our own body. It is not any friends or family members or our profession or whatever. So I always tell this, love yourself firstly and take 1 hour out for your own self. Don't share that 1 hour with anyone, especially your patients, especially your close family members also. So 1 hour you do what you want. You want to relax, you want to think further, You want to exercise, you want to listen to music, or you do whatever you can. So that is where it started. I'm a nerd. I was always a nerd. I was either studying, like most of the doctors, of course. So either I was studying or working. So it's a long time since my mom kept telling me that you don't practice what you preach. So it all changed one day. I was supposed to give a diabetes symposium, and I was told to talk about diet and exercise. So it started hurting me more when I was trying to make slides myself. And then I thought, okay, at least I should do something. So, and then I had few friends around who were running. And so I joined that running thing, started coming to me, and that's how it started. So love thy workout as thyself is what I always tell. And the most important relation what we have in the world should be with our own self. So that is the two important things I inculcate and follow when I talk about exercise.
Dr. Manohar, I will request Kundan to show some of the photographs of Dr. Manohar. And I will ask Dr. Manohar that at what age you started doing regular physical activity, so that our early career physician members, they understand that how important it is to start early.
Well, I think ACP chapter of India has made me like a celebrity. So I didn't expect my videos and photos will be flown. Actually, recently, some 2-3 fitness groups approached me for being their model. So I was very surprised. I don't have a six-packs. Neither I've done. I'm not like a Bruce Lee like figure also with muscles everywhere. So why people wanted me? Possibly, I feel that maybe if you show someone with six packs, you may not relate yourself to them. So if you see a doctor, of course, everyone are busy, and I see many more busier than me, and having reasonably okay physique, maybe people can relate better to him rather than anyone else. So as I said, my running journey was not too old. It was in May 2015, I did my first 10K run. So only in early 2014, late, I started doing some physical activity consistently. Of course, in younger age, we get hyper and see someone and go to gym or do some runs or workouts for a few days, and then we leave it at that. So first, I did my run, 10K Nike run, it was called, in 2015. And then the TCS 10K run is a gold standard run for Bangaloreans, at least for 10K. So I did it in 2015. So I did my first half marathon in 2016. So within a year, I could do it. So after that, I took another year and did my first full marathon. Of course, I would like to acknowledge that there are many more people who have done much more fitness-related activities than myself. And most importantly, some two groups I keep track of. One is the CME India group to learn medical knowledge. The other is a lot of fitness groups I'm a part of. So this group is very, very important to keep us motivated. So I always believe in one thing. Fitness is not that we ran a full marathon or having six packs. And fitness is also not just the workout, what we do for 1 hour a day. So there are many people who do outstanding workout for 1.5 hours. We don't see any results there. Because remaining 23 hours, what you do also becomes very, very, very important. So if you do workout and then you are like a sloth throughout the day, then it is not going to help. We all know sitting is the new smoking, and mobility is the key. Like I work in a very big hospital where there are 11 floors, and 9 out of 10 days I climb the stairs from -1 to 11th floor. So, and even I get dropped at the entrance of the gate and I just walk around. So these important things can be inculcated, because we always, as doctors, we say we are very busy. So if you don't look after yourself, you will not be doing justice to your patients. Many instances, just now I saw a patient who was quite very obese and who told me that I see you running and now I also want to join you. And there are other instances where some people have taken up to running or different forms of exercise, and they won much more medals than me, and they've shown to me. I usually show that photos whenever I'm giving a talk in any conferences. So that's how the journey is. First is we got to be motivated. We need to think, we need to practice what we preach. Secondly, we should keep the motivation up and do different type of exercises. See, there are something like what I see from some others and learn, but when you start the journey of exercises, my own submission is when I started running every day almost. So I used to visit physiotherapy department as much as I used to visit my own department. Means I used to get injured. So these are the challenges what come, and how you overcome the injury will make a lot of difference to your mindset. Sportsmen are definitely different people. One other instance I would like to share, like many times I got injured, even now I'm just recovering from a hamstring injury. One time I did the Mumbai monsoon marathon. So Bangalore is a beautiful place, very good weather, but you can't extrapolate what you do in Bangalore at Mumbai or anywhere else. We see cricket teams struggling abroad or any other state when they go to play because of the pitch is different, weather is different. So I almost like passed off after doing the half marathon. So it teaches us so many things, and it gives a definite high also. Runners high, workout highs also are there, and it motivates everyone else in the house also to do workout. So my kids start playing and jumping around and start running on the treadmill. So that it sends positive vibes everywhere. So that is the most important aspect of it. And especially exercise, as I said, don't be repetitive. It should be mixed. I'm sure I don't want to bore with the ADA guidelines and other things. Resistance training is important nowadays. Endurance is important. Flexibility, balance. So all the four minimum you should inculcate in it. Don't try to do the same thing. You will get injured also. And there's a famous saying that some activity is better than no activity. They always say, do not sit if you can stand, and do not stand if you can walk, and do not walk if you can run. So this year, two things I have done. I told Dr. N.K. Singh, one is to eat early dinner, and sir, I'm successful in it. I'm having my dinner at between 6 and 6:30, and then I come to the clinic. Second thing is I sit in this clinic for maybe 2.5 hours. So instead of using the easy chair, now I have moved to the Swiss ball or the yoga ball. So this gets my posture corrected. So this I'm doing from Jan 1st. And this has made a lot of difference in me. To have dinner early, my acidity issues are gone, and my posture is tremendously improved by sitting on this. Of course, it requires, I face some issues. If someone wants to go all out like me, they can contact me. I'll tell them what are the challenges which come and how to go about it. But there's minor things what we can do, especially going up and down the stairs is very, very important. Even at the end of the day, you should try and do it. I will promise you will reach your destination earlier than waiting for the lifts, and you'll still feel more energetic in spite of the mask I'm talking about. So these are some things which I make small differences in that workplace.
I think this was great message you have just given by showing that yoga ball. I think it is not a yoga ball.
Yeah.
So you have stressed the importance of both the aerobic exercise, the flexibility exercise, and basically the endurance or resistance type of exercise, which is so important these days. Can you say to our physicians who are so, because what you are doing is something extraordinary that every like Amit cannot do, or I think that Burma is doing too much. I am not aware about what Dr. Prabhu is doing, but what to do for a general physician out of so heavy, suppose they sometimes they are working for 8 to 10 hours or 12 hours. So how to basically motivate those persons who don't have much time? So can you give some tips for that?
So the biggest myth in life is we don't have time. Okay. First is stop that wrong notion. One message I would like to give here is in the 5th decade, 45 to 55, if you look at it, the most common professionals to have myocardial infarction is medical professionals. Yeah. So if you don't have time for yourself, make time for yourself. We find it very difficult initially, especially early care physicians. I could have gone and practiced there. So whenever some people meet me, I tell some clinic or some point of work, you leave it. Okay, so it may not be very easy, as you said. So I always tell, love yourself. 1 hour a day is yours. Secondly, fitness is not just doing exercise. Nutrition, very important. Physical activity is not just exercise, what I do, workout or whatever, but as I said, interrupted sitting, using stairs, walking as much as we can is very important. Sleep and mindfulness. These are very two important entities because even we have seen a lot of people who exercise succumbing to cardiac illness. Mainly when we look at their activities, if I'm overstressed on a day and when I get up and I don't feel rested, I won't exercise. I give up. I will tell my trainer, it's okay, today I will not exercise. It's fine because there are many people, even the famous film actors we have seen that they party or work till late night and get up with the improper sleep and start doing the workouts. Because sometimes this workout highs or runners highs is a problem also. We always talk about mind over body. Mind, of course, is placed over the body, but you should listen to your body also. Get up, don't feel fresh, don't work out. Secondly is mindset. It's a famous quote that mindset is the difference between successful people and unsuccessful people. So you got to change our mindset and give time for ourselves and discipline. So mindful eating, exercise, sleep, all the ingredients should be encompassed for us to be successful in exercise. It's not just you do something and you think you are fit. I'll be honest in my acknowledgement of how poor I am with respect to fitness. I got recently evaluated by people. I'm very good in my endurance. I'm very good in my aerobic and anaerobic thing. But when it comes to flexibility, I'm very, very poor. So we should always encompass everything and we should have a reward for ourselves, running something or going out with friends and participating in an event. Having our groups, I've seen a lot of cycling groups, runners group, hikers groups, very, very important. Swimmers, there are Ironman. There are many doctors who have done Ironman. I'm not dared to do that yet. So we should feel happy about what we are doing and we should first look after ourselves and be role models. That is my main message there.
So do you recommend that suppose we don't have time in the morning, so do you recommend any specific time, suppose in evening time or afternoon exercise?
Yeah, I think you have spoken extensively. I've heard a lot of your talks on
that. That is okay, but today you tell what is your opinion?
Yeah, my opinion is time and place, unfortunately, can't be same for everyone. It's easy for me to say 1 hour you take out, but you take out in the morning or in the afternoon or in the evening, should not be a problem. What I would say is, of course, you should not have had meals at least 2.5 hours before you start exercising. Okay, and you should have a restful day. You should not be stressed out and start exercising. Already the adrenal surge is high, or if you had COVID or any other infection, again, you should follow the disciplines. I intend to run one more full marathon. So I did all my health checkups. I did my CT coronary angio also because I was scared when I was doing, I had some minor doubts whether this chest pain is this thing. So we need to take care of ourselves also. Because we had a recent incident, one of our colleagues who is younger than me, recent COVID, was scrubbing for a case, a neurosurgeon, and he just collapsed. We don't know what is the cause. But if someone else was there, if the same as a different patient would have consulted us, probably we would have told you do this test and do that test. But for our own self, do we really do it? Many places it is said doctors are poor patients when they get to illness. So we should change that mindset. Of course, patients are important, but I think we are much more important than anyone else for ourselves and our close family. We can't be replaced. If I am not there, they will see someone else tomorrow. That is okay.
I think, do you have any aware about any study regarding the using music during exercise or during run? Because I have seen many runners have some musical instrument, thing playing in his ear. So do you have any better effect it brings down or brings or not? That can you say?
Maybe if you know, you can tell that. But I always tell one thing, especially in our country, when there are no dedicated lines for exercise or cycle as yet, in few places it is there. Putting music and running could be dangerous also. Yeah. So I am a bit very scared to do that unless you're doing it in close surrounding and place is secured. So please don't do that on any street or something which we usually end up running. I don't have time. So what I do is there are people who go to exotic places and run Kaban Park, Lal Bagh, one university campus and things like that. But I have my limitations. Even Sunday I might have to go for rounds. So I open the door and I do some stretches and start running there. So I discourage music in such circumstances. But otherwise, definitely when I have done indoors, music is a great thing. sometimes we watch some documentary or something, also do the exercise. It gives a different feel for us.
Yeah, I think that is the answer. Only thing I have just come across a study done from the US that while doing this Surya Namaskara, when they did it with the mantras and music, it brought too much beneficial effects. So that is documented in the science itself. So that is the one information I would like to share. Dr. Burma, what is your opinion or any questions to Dr. Manohar?
I think Dr. Manohar has very clearly given the insight that you should love your body. And once the physician or doctors start loving themselves, then the problem will be solved. And there is no fit formula for all. We need a different formula for different persons. And the physician himself is the best judge what he can do and what time he should do and what type of activity he should do. One cannot suggest activity for all the group. So I think he has very clearly told that. And I love that he has said that it is a myth that I do not have time. They have time to chat on WhatsApp. 70–80% of physicians are busy on WhatsApp. They can't miss a single message for 10 minutes, 15 minutes. No, they will reply. So they have all the time for chatting on WhatsApp, but they do not have time for physical activity. I will not agree. I can give some tips what I am doing. Because in my town, doctors are most unsafe persons. If I go to outdoor, there are 4 or 5 problems in a park. One problem that everybody recognize me. He want to consult me even at park. Not giving any fees. Second, I can be hit by any vehicle, anytime. Third, somebody try to snatch my golden chain and he may kill me. Fifth, in Lucknow, not in 5 years, but 10 years before, most of the doctors were killed while they were on morning walk. Because that time everybody knows that he will be at that particular time, he will be in that particular place.
Yeah.
In last 5 years, this has not happened, but before it was very, very common. And if 1 hour I am out of my house, then I may miss some important engagements. So what I do, every doctor, every person, I think reads some newspaper. So while I am reading newspaper, 30 to 45 minutes, my legs are on bicycle, static bicycle. So while I'm reading newspaper, I'm busy, my legs are busy doing something else. So those 45 minutes can be utilized while you are reading gossips. Nothing in newspaper, is still you can't leave it. And second thing what I do, I had a big campus. So I go by the car, park it at my place, and then whole day I keep on walking from this place to that place to this place. And our this Kalam Center where classes are being held, it is 6th floor. I never use lift. I always go by stairs. And I reach before my students reach by lift. Because in lift there is a capacity. But in stairs you can move. So these are the few tips one can design themselves. Nobody, including Dr. Manohar, can tell everybody that's what they should do because the physicians know themselves. Only they are avoiding it. Nothing will happen to me. They think that they're immortal, but that is not truth. And you're very correct. Most of the time, what I advise to my fellow physicians, and most of the time, when they are overweight, then I say you have no right to practice because you are not abiding to the laws of the health. So if we think in that particular direction, time will definitely come. Automatically it will come.
Dr. Amit, do we have some time or should we wind up?
Yes, sir. We are 8:35. We can wind up. I would just like to make few pointers that what Dr. Manohar has said is that he is a busy doctor. We should look at him that he is going to a very big hospital also. He is running his OPDs also. But if he can take out time, then all of us can take out time. So everyone who is watching this episode, it is a sincere request that it is equally important to take care of your own health. So an ACP India chapter has a particular emphasis on this. So there are a lot of activities which are done for well-being of the physician, and there are well-being champions also. And it is at the forefront of ACP India chapters. It is one of the mission of the ACP India chapter that each and every doctor should be healthy. So each and every member of the ACP India chapter should be healthy. And this is what, if Dr. Anuj Maheshwari would have been here, he would have highlighted. He had some other commitments, so he could not join today. But Dr. Narsingh Verma sir is here. So he has very excellently pointed out that exercise is very important. Dr. Manohar, I can see a lot of medals behind you. As it is difficult to even count. I think they are 50 plus.
Everything is with respect to non-medical only. It's all running related.
Yes.
Related one.
This
I
is
have to throw it somewhere. So one of the patients told me, "Why don't you put it there?" And it motivates us.
Yeah, it motivates definitely.
Definitely, in a day, if I see 10, 12 patients, also at least 4, 5 people will ask, and 1, 2 will join me that weekend runs. So that is doing a good job of promoting fitness to my general public and the patients. So recently I have started one thinking process like lifestyle as a prescription. So lifestyle as a prescription, we should also write for others and we should also keep it for ourselves also. This is one prescription which we need to follow. So love yourself. 1 hour a day is not a big thing. So firstly, you love yourself. Nutrition, very important. Food, how much, what, and when, all three are important. Physical activity is not just the 1.5 hour exercise, but what you do the rest of the day, as Narsingh Verma sir rightly pointed out, is important. Sleep, never neglect it. It's one of the most neglected entity. Nobody talks about it, but that's the most important thing. Mindfulness and self-discipline. So if we inculcate these 5 points, I think we will be a good role model to our patients. And as I said, I don't have any 6 packs to show or any muscular body, but this figure possibly relates easily to patients than someone with those high achievements with respect to body image. Thank you very much for the great opportunity. And I've been a great student of Dr. N.K. Singh and Narsingh Verma. We know him. I studied in Bangalore, KMC. And he presented a very difficult case. We always say PEO is the biggest challenge to all of us. So I always joke, if you have any enemy physician, you just refer of such cases to them and let them handle it. But he has done a great job with that. And thank you very much.
Yeah. Dr. Prabhu has done a great job. And Dr. Manohar, you have also done a great job by just motivating our physicians. And even we have got some message from the Dr. Verma also. It is a very dynamic personality. I think I have no words to praise him. But anyway, he is doing a great job.